Good day, here we go. Good day, everyone, and welcome to the webinar, Beyond Compliance, Building a Business Case for Healthcare Accreditation Technology. Our speaker today is Christy Kerwin for PowerDMS. At this time, all lines have been placed on mute to prevent any background noise. We'll have a question and answer period at the end of the presentation. You can type your questions using the prompt on your screen. They'll be answered in the order that they were received. When typing your question, please identify the name of your organization at the beginning of your entry. This webinar is being recorded and will be available in the CIHQ YouTube library within a few days. It's now my pleasure to turn the conference over to our speaker, Christy Kerwin. Christy, you have the floor.
Thank you, Michelle. I appreciate your time today. Welcome all. I appreciate your attendance to this session. I do have a little bit of an announcement to make. I'm joining you guys from the beautiful airport in Salt Lake City, Utah, as I'm doing a little bit of business travel. So this session will end at 12 instead of 12:30. I apologize for the 30-minute gap, but I have to jump on my flight out. But please, I will leave time at the end here for questions, as well as continue to send those questions to me if you like. I'll have my contact information available to you all, and I'm happy to answer anything on the other side of this conversation. So this is myself, Christy Kerwin. I am a nurse by profession. I've been in the industry for a little over 30 years now. I started when I was 2, actually, but you know how that goes. I've spanned the market from working bedside to working in education, which is my true passion and love, and also in accreditation and regulatory compliance, which is my second love. But they share equal spot in my heart for sure. I now work at PowerDMS. I got into the business side of healthcare a little over 8 years ago, and have really enjoyed working with technologies that support everything that we do day to day, and hopefully trying to make it a little bit easier. But when I made that transition, I quickly realized that what I didn't have as a skill set on the other side of the business industry was the ability to see healthcare as a true business. I always felt that I came to work every day, took care of patients, did my best to make sure they stayed alive, provided the best care, made sure everybody under our umbrella, under our roofs, in our facilities provided that same level of care, and we had significant promising outcomes on the other side. But once I got onto the other side of the world, I realized that there's a whole underbelly of the hospital world that's called the business side of it. And that's where they look at things called revenue and operational budgets and all of those things, and that we truly have to turn profits, whether you're for-profit or nonprofit. You have to make money in order to keep people employed, to keep services going, and to enjoy and provide things that are technologically advanced. So what I want to share with you and talk about today is how do we, if you're sitting in the same seat that I was a few years ago, how do we start talking the language that our executives need us to talk so that we can make sure that we make good purchases, good technology decisions for our organization that help improve our department efficiencies, that help improve our overall outcomes in our facility so that we can do things smarter, not harder, and things like that. So today we'll use a lot of that language, and I'm going to show you how to build a business case. So we're going to link some operational needs with our organization's strategic objectives. We're going to talk about articulating a clear ROI. And if ROI is one of those acronyms that you're not familiar with, which there's tons and tons in healthcare, that's return on investment. That means whatever I've bought provides same or equal or greater value to the organization for what I spent on it. And then we're going to showcase the value of the solutions that can provide, how they streamline process, they can help improve quality outcomes, and they can actually help reduce costs overall. So what's the first step of building that business case? The first thing you need to do is assess the need. What do you need in your organization? And I'm going to provide you a few questions that you need to ask yourself, because first you have to prepare yourself before you can start sharing and just giving these ideas out to others, because you want to make sure they're going to ask a lot of questions, as they should. And this is an investment for them, so they want to make sure that this is a good investment. So the first couple of things you want to start with is, what are the primary pain points I'm trying to resolve in my department? Is it efficiency? Is it, we're just chasing things that we shouldn't have to chase because they're just, I send out 75 emails a day, asking somebody to update a policy, or asking several somebodies that are equally busy wearing a many number of hats, to many, many questions. So can you please look at the policy and get that back to me ASAP? So ask what type yourself, be honest with yourself, write it down. What primary pain points am I trying to resolve in my department? Then think outside of yourself. Are there other departments experiencing the same pain points? We'll talk about why this is super important in just a little bit. But if you work in a regulatory department and you're managing your CIHQ accreditation or any other type of federal accreditations, think outside the box. Do you have a radiology department that's accredited by ACR? Do you work in an organization that has a level 1 trauma center? Do you work in an organization that has medical education? You have residents, so you have a different ACME or other types of medical education. Do you have a strong nursing education department that runs programs like AHA? Are you working in a magnet organization? All of these are examples of how departments could use technology to manage the accreditation process. Are there technologies that are already being used in your organization that could mitigate these pain points? It's always good to do a scale. So oftentimes we find that in healthcare, we're working in silos. As much as we hate it, it still occurs. And what happens in silos sometimes is technology acquisitions or technology purchases that are bought for a single purpose, but could have maximum value if spread across the organization and used. And the return on investment, that ROI, is greater when it solves many problems in your organization. And your CFO really, really likes that, because then he or she only has to spend that money once. And then what I want you to do next, once you've identified what your pain points are, if there's other departments that are experiencing those same pain points, and then if there's no technology within your organization that's already meeting those pain points, I want you to start doing a market review. So you can use a Google search, you can use any type of searches, but there's all types of organizations out there that review healthcare technologies, Capterra scores, and different sites that you can go and compare and contrast. You can, once you find technologies that you're interested in, you can log in and request demos to these technologies and really start doing your work, your own legwork, to make sure that, are these products that I may recommend really what I need? And then how many of those products exist? And then start narrowing that list down. The next thing you want to do after you've identified a few products, start asking yourself, would this project align with your organization's strategic initiatives for the year? Typically every year, and it generally aligns with your financial calendar. So if you go by calendar year, January through December, January through December is your fiscal cycle. Or if you're going July to June as your fiscal cycle, just make sure that you're pulling down what your organization's strategic plan or your strategic initiatives are. And these often, there's a universal one for your organization, and then these start to be narrowed down into departmental. So the nursing organization may have strategic initiatives and strategic plan that has rolled down or cascaded from that strategic plan. So start aligning your pain points, your technology needs, your desire to spend, and the technologies that you've identified. See if they align with any of the ongoing strategic initiatives. It's a lot easier to sell it when you already know how it aligns with a strategic organization, internally sell it. Then ask yourself, are there any sacred cows that you're going to be tipping by pursuing this project? Now, I love sacred cows. I love them because it means that there's a very passionate person on the other side of that sacred cow that worked very, very hard to have certain initiatives passed or to have certain technologies brought in or certain processes developed for certain things within it that they have oversight of. So make sure that you are a little political with this. Make sure that you identify the sacred cows and you leverage a relationship with that person that created that process or brought that technology to the table, etc., and work with them to see if there's any room for expansion or to get them aligned with what you're wanting to do. Get them on your side early. Are there competing priorities? So this is like priority number one for you. However, if your organization is working on an EMR, changing over their EMR, or there's some other great initiative, they're building a new facility, or you have a big merger and acquisition coming on, then you know that there's competing priorities that will put your project automatically on the back burner. Be aware of those and try to tie what you're trying to do, how that maybe could support the project, especially if you're looking at something like a policy management or an accreditation management product, because you need those types of products to help support your accreditation needs and your training and policy update needs and all of those things. So see if it actually aligns with those competing priorities, again, aligning it with that strategic initiative. And then identify what data you're going to need to validate the purchase. Some data that you will need is what's your current spend on the processes that you're trying to buy this technology to replace. How do you identify those things? So if you're trying to buy a product that's going to take over some of the menial task of a person that's paid hourly or paid a salary in your department, think about how many hours they spend on that particular project, multiply that times their hourly rate, and then that is your cost on that person. That's the cost for what it currently costs you internally. And then you can start comparing that, do it over annualize that, do it over a year. And then you can say, this is what it costs us currently to do it for a year. Would the technology spend decrease that? But remember to look outside that box, because it's not just that they do it one time, it's how many times they do it, how often they have to replicate it, how often are they having to do the process, and then also, is it more than one person? So the person receiving that information on the other end, and then what work they have to do in order to navigate and complete the project that they're being requested to follow through on. The next few questions you're going to need to know is, will there be any additional resources needed during the implementation of the project? i.e., is there human factors in this? Are you going to need to increase your time for your support staff or for IT or things like that during this project? Make sure that you include that, because they're going to want to know, like, okay, what's the plan for the implementation and how many people are going to be needed, etc. How many people is this going to touch? Is this going to be super disruptive to our environment, or is this going to be a relatively easy implementation process? Like, is all the staff going to have to be trained, etc.? Then understand what type of technical services you have. If your organization is already very cloud-based, and that's what they prefer, or if they prefer everything to be in a software, hard-coded type process, like, find out from your IT team, get them engaged early, and identify what technical functions you need. Now, if you were like me, my offices were often down in the lower levels of the hospital, and Wi-Fi tended to be a problem for our offices. So are you going to need additional hardware like Wi-Fi extenders, or even in some of your units? You think about in your cath labs and areas where there's leaded walls and things like that. Are there additional hardware things that you're going to need your IT team to support providing, especially if you're looking for a platform or something that is going to be offered via Wi-Fi or mobile application or things like that? Who do I need to engage as an executive sponsor? This is not your best friend that always says yes to you. This is that hardcore executive that sits in the same room with the rest of the people that have to sign off on the contracts. But you know that they understand your plight. And if what I say is align this technology with the services that they provide or oversee. So if you're looking at like a policy management system like PowerDMS offers. If that's what you're looking for, engage your COO and your CNO. They're going to be the people that are going to be most likely to understand what you go through on a daily basis, and are willing to put their neck on the line and say, yes, I definitely want to support this person's plight. And then identify how you're going to measure return on investment or impact. So how are you going to earn the money back that the organization is going to spend for this technology, is what that means. So is it going to decrease a certain situation? So is it going to decrease error in medication administration? Is it going to decrease error in restraint management, in restraint, managing the care and documentation of restraints? Is it going to decrease your risk when you have the accreditors come in your organization? And oftentimes that's something that's overlooked, and we're going to talk about why that's super important in just a moment as well. But identify what your metrics are for how you're going to measure the impact of the purchase. And then I want you to sit back after you've done all of this hard work, and I want you truly to identify what's at stake if this project is declined. And I want you to be able to state that in simple terminology. What's at risk if this project is not brought forward? Is that a risk of staff burnout? Is it a risk of being at risk of losing your accreditation status? What is that true risk and what's at stake if the project is declined? Now, Christy, that's a lot of questions. That's a lot of work already on the front end, and I haven't even started doing anything yet. So why is this so important? The reason that it's important is because you're going to need to write a concise business case. And this is a template that I like to use. I use this now. I used it back when I was on the other side of the healthcare space, working in the facilities. And I would always say, all right, I'm going to build a strong business case. And I've gotten better at it as time goes on. But I'm going to just show you a couple of things. So all those questions that I told you to ask yourself, you're going to see why they're important. So first off, you're going to start with who you are, what's the date, and then what's your project title? What are you actually looking to achieve? Remember, I told you to check out your current state. How is this being managed currently? Take a real good review of that. And it may take more than this box, and don't worry about that. What internal process does the software support? Is it policy and accreditation management? Is it contract management, quality and risk management? How many different things can this one software do and take the place of all the menial work that's being done? Make your work more efficient. Are there other departments that would benefit or could use this software? And the sky's the limit here. What I will tell you in my experience is that the more departments that the platforms can meet and exceed the needs of, the better off, the more luck you're going to have in getting this approved, for sure. Is there strategic alignment? Which strategic initiatives does the software support? A lot of organizations right now, I see strategic plans come across all the time from our sales teams. And one that I always see is there's a strategic initiative to increase technology utilization. Well, what does that mean? In what areas do they mean that? Is that only related to EMR and enhancements made to our EMR? Are they open to other areas? But tie it back to that, a strategic alignment, and help them understand why that ties in. Improve quality and safety. Obviously, a policy management system that we're talking about here is very much a front line for improving quality and safety, because if the staff don't know, they can't perform accordingly most of the time. Is it a cost-effective staff resource? And then, obviously, if you want to obtain Trauma 1 status, you need an accreditation process. Somebody's either going to manage this with binders and reports printed off of computers and put into binders to review, or you'll manage it through a technology platform. Who are your potential vendors? And this is where you got to do your homework. Go out and find out who does this, who's the best in the industry, and who says so and why, and what's the potential for them coming in. And then measuring the value and impact, that ROI. You can do that through KPIs. Some of those key metrics could be time, saved time, Efficiency, getting things done faster. That policy review process is no joke. Can you do things to decrease the time that it takes and increase the efficiency, decreasing the time on the CNO to have to sign off on things, or the CMO, or whomever has to sign off on any of your policies and procedures? Increase that efficiency. You make their job easier, they're going to love you. You'll be their hero. Standardization. There's a lot of mixed conversations going on in the space around standardization. Some people really like it, some people not so much. But standardization, as we learn through books and things like checklist manifestos and things like that, does have its place, particularly in healthcare, where some of the things that we need to do and some of the things that are measured and monitored through our quality metrics, through our accreditation standards and things like that, are things that we need to standardize the process around and make sure that not only when surveyors are on staff or on site, but when our staff is doing things day to day, that they are doing things the way that we've intended them to be done by the policies that we've done. Risk reduction, making things available where patients are providing care. This is really important in the home health and hospice environment where the staff are not working at the bedside. They're actually out in the people's homes, and they need to be able to have really quick access to your policies and protocols to reduce risk that they're going to do something wrong. And then the last thing is staff engagement and satisfaction. Just covering their behinds will keep them engaged and let them know that you've got them covered. But also putting it where they are, where they can access it. Our new generation is really an on-demand generation. They want that information available at their fingertips. So a lot of us have gone to phones, in shared devices within our organization and things like that. What a better way to engage that technology to bring things to the palm of their hands realistically. As we identified, find you an executive sponsor. Legal Lionel is going to be my executive sponsor. And then, last but not least, ask yourself what's at risk if they say no to your request. What I've tied to things like this related to your accreditation is what % of revenue is tied to CMS payments. If you don't know that, which most of us do, it's a pretty common metric that we all understand. But if you don't know that, definitely know that. And that starts turning your overhead department, as we're often called in these spaces, to a true revenue generating space, because whatever you guys make, whatever your organization makes related to CMS payments is all because of your due diligence with the accreditation process. Without your due diligence to the accreditation process, you would not receive CMS payments. So that means that you are indeed a revenue generating department. So claim that, leverage that, use that. And then when was your last payout secondary to practice failures? Understand, and that's why my executive sponsor is Legal Lionel, because I want to understand, what if we just arbitrarily paid because we couldn't go back and look at prior policies and procedures? We couldn't look at archived information because we have a SharePoint file that gets overwritten, or we have something that they have to print it out and keep it in some file, but they don't know where that's at right now. So we just write a check. So things like that are some things that you could leverage to say, hey, these are the things that are at risk if we say no to projects. The next thing is to plan your pitch. And really, there's just some core elements to know. When to ask. Sometimes it's all about timing. I tell my daughter this all the time. She's getting ready to be 21. Sometimes when you ask mom really hard questions, it's all about timing. And one of the big timings in asking for technology projects is the budget cycle. Understand your organization's budget cycle. Be aware and start doing your legwork just before your planning cycle. So typically February, March is your planning cycle for your fiscal budgets. If your calendar year, you typically start August, September. Know what your budget cycle is, start your planning, be ready to make those requests during the budgetary request time. Understand if this is going to be a capital investment or a departmental investment. And typically that's a dollar figure that your organization identifies for what you can approve contracts for. So that means in that legwork that you're doing, where you're finding vendors and knowing what they offer, is identifying what the potential cost will be. And any technology in this space, particularly in the document management space, worth their metal, will provide a general pricing for you in that regard. RFP and RFI process. Do we have a procurement department that mandates that we have to go through them for purchase? That will often delay your timeline. So just know in advance if you have to follow that. And often that falls in line with if it's a capital purchase or a departmental purchase. So just identify if there's a procurement agency, and then if there's an RFP or RFI process, and what's the dollar amount that is limited to that process. And then again, get that cost estimate. We talked a little bit about the technology process. Understand what tech type you're looking at. Is it something that they have to add on to your systems and then they have to touch every device in your organization? Or is this a cloud system that is just brought in by API? And then they'll understand what that tech lift is based on that tech type. They'll understand what the tech lift is, and then the level of IT involvement that is required to get you up and running. And then truly lay out what your project timeline is. If you're getting ready to have survey in the next 3 to 6 months, it's not a good time to try to purchase a new platform to help you manage that process. Just delay it until after your survey is done and you get through your corrective action planning work. Let that be a part of your corrective action plan. And then people. Definitely get your executive sponsor. Make sure you've answered all of their questions so they feel good about putting their neck on the line. And then we talked about other departments that may use the system. That's your key stakeholders. That's other people that would benefit from this purchase. And then think about your end users. Think about the time that it's going to take to train them. Think about how big of a variance this is around their current process. That's why you have to understand current state, and then move forward. And then, as always, have your risk versus reward. What are you looking to gain? And then what are you at risk for losing? And this is really going to be important because in your executive conversation, we're going to talk about what you have to do to be a good person selling your desires. And that's what this looks like. So, current state, all of these things we've talked about, but now I've added project timeline. I've added budget type. I've added projected cost. I've added the technology type. I've added the technology lift. And I've added continue to engage my executive sponsor. And I've added key stakeholders. You see how your business case is coming to life. You have your 30-second elevator pitch, which is the story that you're going to tell your executive team when you pitch this project. And then you still have your what's at risk if the answer is no. So now you feel like, oh man, I'm almost ready. But remember I said identify your key stakeholders. So I need you to start building your trusted circle. This is what I call building your trusted circle, or identifying your key stakeholders or other people that you need to include that will also beat to the same drum as you. When you're building that trust circle, though, don't just include your best friends down the hall or somebody that's always going to shake their head in the same direction. Look for people that are truly inquisitive, that are going to ask you the hard questions. Ask those creative people, those people that think outside the box, that always have something to share that you're just like, where did that come from? I don't know, but I like it. Pull in that truly logical person that's like, yeah, but pull that logical person in that's going to pull in that series of logic, because you're out in vision world. You're envisioning this. You're being very visionary. You're being forward. You're being innovative. Have that person that's very logical and grounded that's going to bring you back to earth. Remember, you're having to do that market search. Find somebody that's tech savvy, that understands the language that those tech companies are using. That can be super hard. You think that we have a lot of acronyms? The tech world has a ton of them. So find somebody that's tech savvy. Go to the IT department, engage them early. Find that person that's change adverse. That person that has been there for 25 years and they don't want to see another project come down. It's always something. It's always going to take their time. That always says no. Find that person. Find that person. And then get people that are impacted. And most of these people will be impacted by the same pain points that you have. Inefficiency, hard to find, etc., etc., etc. Share your big idea. Share that document that we've been building. But when you share, make sure that you're vulnerable. Understand they're there to poke holes. If you have a team that is that eclectic, they're going to poke holes. So be vulnerable. Don't let this be your sacred cow. Allow them to tip it over, tip it upside down. Remember, you haven't gotten to the executive committee yet. You want to experience this before you get there. Be open-minded. There may be things that you haven't thought about. So you want to make sure that you're putting those additional ideas and bringing them to fruition and thinking about it. Be flexible. Remember, I told you to find that one person that's really change adverse. Be flexible with them. Don't let them hurt your feelings. Don't let them hurt your ego a little bit. Don't let them talk you out of what you want to do, but also take their concerns and flesh them out. Be flexible in the process. Be honest. If at the end you guys go through this process and you're like, yeah, okay, it's not as great as we thought, it's not going to be as impactful as we thought, be honest with yourself and be prepared to walk away. The other part of be prepared is be prepared to pitch your story. Not everybody's going to be all in from the moment you speak, but, well, I said most likely it's going to be opposite, but embrace those challenges. It's going to make your conversation with the executive team that much better. And then when you're all in the same boat and you're rowing all in the same direction towards that big, bright idea, the next step is getting your executive buy-in. When you finalize your business case, the sharing section's ready. There's just 3 things to remember when you are engaging your executive team. Be quick with what you've got to say. That's why I promote the template that I've provided for you here. We will be sharing that. I'm willing to share that at any point in time. Be good. Understand what you're talking about. Be concise in it. Identify everything that you think that they could potentially ask. And then when they've asked all the questions and you finished your projection, be gone. Don't continue to beleaguer the point. Allow them some time to sit in the data, to sit in the business case that you've provided, and to make some key decisions. I promise you that if it comes back as a no, you've already identified what that it looks like for you. And then you can have a rebuttal time in that regard, making sure that you share, like, I understand you said no. And remember, no is not always no forever. It's just no, not for now. And that may be because you didn't understand some of the priorities that were already going on and that were already promised budgetary spend. So just to remember to be quick with what you've got to say, have a template, understand, do your due diligence, be good, clear, concise, honest communication. And then once you've handed it to them, there's nothing else to say. Be gone and let them provide some feedback to you when they're ready, when they've had time to mull it over. If you push in that moment for them to make a decision right then, most likely it's going to be a no, not now. So just be gone. Just leave it with them. Thank them for their time and let them spend some time reviewing. So again, you've got all of your required components for that business case that you solidified. And here it is in its beautiful glory. I'll go back to that one. Once you ask all those questions we talked about in the beginning, step 1, once you've pulled all your people together, as we mentioned in step 3, you're ready to present this. Make a copy of it, pass it out, allow them to take it away. But you have a full business plan that is truly identified by every level of area or anything that it could impact if they say yes to the project. With that, I'm going to close and open the floor for any questions. Can you first explain an example of a sacred cow? This came from Stephanie. The fun thing about sacred cows is that a lot of times you don't know that they exist. But what I'll share with you is an example of one that I tipped. It's a proverbial statement that I've used a long time, so it may just be an old statement that you may not align with. But an example of a sacred cow that I came across was that I came into a new organization, and I came in as the director of education and regulatory compliance. The person that had that role before me had passed away unexpectedly, and they were within 6 months of their survey window. So I came into the organization and started just doing a mass, 6 months is a short amount of time to get ready. So I just started really just mass view of everything, just looking through people's records, being on people's floors. EOC rounds had not been done in ages. And I just took everything out of everywhere. And on the OB floor, they had a book that was hiding in a doctor's dictation room of all the policies that they had printed out of the policy management system and had put back there because nobody could ever find anything when they needed it on the platform. I took the book and I proceeded to, in our leadership meeting, I always had to report out. I proceeded to say that, we're finding things like this. And I sat that book on the table. And what I didn't realize is that was a book that had been developed by that OB manager. And it was her claim to fame. Like, she had made it easy for her staff. They were happy. They wrote about it on their staff, forums, how happy they were. She had the happiest department and all of that stuff. And she left angry. It was not personal. I didn't know who did what. I just knew that it was not accurate. It was not okay for us to have that, especially with the pending survey. And she was very upset. So I tipped her sacred cow. Like, that was something that was very sacred to her. She had a lot of pride in it. She had made her staff happy by doing that. But I had basically just tipped it and walked away and left it to die, because cows that get tipped over could die from their stomach being flipped. So that's where the terminology comes from. But that was my example of an example of a sacred cow. It's often something that you don't know it exists until you trip upon it. That's why I say look for them. Identify things in your organization that people hold very tightly to or feel very strongly about. Did that help answer your question?
Thank you, Christy. Here's another from Sarah Saylor. Is there a
Yeah.
standard amount of vendors you should seek out? How many options should you seek out on average?
Yeah, so I always say that it depends on the technology that you're looking at, obviously, because some areas of technology are very limited on choices. There's not a lot of them out there. Good, Stephanie. But if it's something that when you Google it and you find 4 or 5 vendors, then that's a good selection to come from. But if you find out that may be the only vendor that offers the services, that's okay too. Just do your due diligence with that vendor. If you're seeing that there's like 10, 15 competitors in the market, I would say pick a good, strong 5 at first. Use that team of people that you've pulled together to be on your side to narrow that down to 3 choices. By the time you go to the executive team, if you have more than 3, they're going to be overwhelmed with all the information that you could potentially provide to them about those vendors. However, if you have an RFI or an RFP process in your organization through procurement, they may have a policy on how many have to be evaluated. That process is a little bit more stringent, I would say, and they may dictate how many that you have to go for. Stephanie said, would it be appropriate to ask my CEO, since I am new here, what are your sacred cows? They may not know either. Honestly, it's really one of those things that it's relational. I would say how to better address that, you could directly ask them, but they may have some that are not, that's not other people. So each person's going to have something that they feel very fondly about. It could be a process that they've developed. It could be a technology that they've brought in. It could be a person. It could be any number of things. So I would say, the construct of sacred cows is something that I try to manage. There's actually a book about it. If I can find out, I'll get the title and send that to Michelle. She can send it out later. But the purpose around that is that you learn to be relational and you learn to ask questions instead of just assuming something's broken and you have to fix it. That's kind of the core premise around understanding what the sacred cows are, is because somebody has probably spent some time on it. It's not you've come in and you're new and you've just discovered that it's a problem. That's typically not the case. People have known it's a problem for some time and they may have their own Band-Aid fix to it. And you come in and you tend to be more technology focused, where they were less what I call low fidelity fixes. and they've put that Band-Aid over it, and they thought it was the best thing since sliced bread. But now you come in with a technology, and you're like, this is the best. Good questions. I'll find the answer to that. I'll find the title to that book and get that to you guys. Yes, it's
Christy,
definitely interesting.
yes.
Yeah.
Will you put your contact information back on the screen?
Yes, absolutely. Come outside. I think there's not a good way to go about it. Let me stop sharing it and then go
Okay.
make it not a thing on my computer.
Well, thank you everyone for joining us. There are no
Yes.
more questions in the queue. Christy, I know you have a flight to catch. So again, a reminder, this has been recorded. It will be on the CIHQ-ARS YouTube channel within a couple of days. You can look back at the partner webinars that we've got on there historically. Some really interesting things there. All right, everyone, you've got 15 or 20 minutes of your day back. Have a wonderful time. And Christy, there it is. Okay, very good. I'll leave the webinar open until all the attendees fall off. Thanks, Christy.
Thank you guys for your time today.